That's what I do.
Coming.
So, all right. So we're going to get started here in just a second. This is the Art of Emergency Nursing podcast. My name is Kevin McFarland, and I am joined by not one, but two brilliant women who are going to share their information about coronavirus. We're going to talk a little bit about coronavirus. Understand that all the opinions, all the words are our own. They don't represent our organizations, our jobs, our hobbies, or anything. We are speaking 100% solely for us, and we may make some stuff up. So just always check the sources. Always check your. We're gonna give you some places where you can check information and get the latest information. Because if you're listening to this podcast a week from now, a month from now, this all may be completely changed. So that is our caveat. That is our disclaimer for today's podcast episode. This is going to be a podcast and a video cast. We have both. So if you're listening on the podcast, you can go to YouTube, search Art of Emergency Nursing. You'll be able to find it there. If you're listening on YouTube, you can put it in the podcast player and listen in your car. And there's going to be minimal edits here, so if you hear me coughing, then I'm sorry. I don't have coronavirus, I promise. All right, ladies, I'm going to let you introduce yourselves, tell them who you are and what you do in general strokes, and why you're here and why you're interested. Sarah, we'll start with you.
Hi, so my name's Sarah Wells. I'm an emergency nurse for the last 10 years, and I work in Northern California. I'm based out of Oakland, California, and I'm the founder and owner of a company called New Thing Nurse, which is a company that's founded to foster a more supportive healthcare environment for nursing and beyond. And really, I'm here to speak to you guys about there's a lot going on. It's a stressful time. This is an ever-changing climate. And so what I'm hoping to speak to today is some reassurances that about how we can take care of ourselves while we're taking care of our patients. Got a big focus on mental health and nurse wellness in what I do, and I have a long history of mental health struggles myself, and this is a very trying time. So I think we can just talk about being kind to ourselves, being kind to each other, and hopefully give you some resources and tools that'll help you in this time and in the future.
Kristen?
And I'm Kristen Cline. I have been an ER nurse, flight nurse, and now an ICU nurse. I have 13 years of clinical experience, and I'm also a speaker with Solheim Enterprises, so I get to travel around and do lots of education, and education is really the thing that I'm passionate about, so I was really, really excited to have the opportunity to talk with Kevin and Sarah and just bring some education and some facts, and hopefully that will help with some of those anxiety issues, because when we know the facts and what's going on, then we can come from that place. And I'm also very proud and honored to serve on the board of directors for the Emergency Nurses Association. So I will be sure to clarify when the information I'm giving you is direct from there, just because there are some things that I want to make sure we clarify that's coming from the association. And I have to say I've never been prouder of being an emergency nurse. Our association is amazing. There's amazing resources available to you, and that's part of why I wanted to come on here, is make sure that you were aware of those resources and to know that your association is here for you. And we got this. As emergency nurses, this is our time to shine, right? This is what we prepare for, right? This is what we practice for. So hoping with Sarah to give a little bit of encouragement and reassurance, and it's okay to be scared. We're all a little scared. I'm a little scared myself, and that's okay. It is uncertain times, but we're going to get through this together. And we got this. So thank you, Kevin, for inviting me. I'm excited to talk today.
I'm super excited. Super excited to have this conversation. I think that there's a lot of healthcare workers out there that are, they're working hard. They're struggling they're struggling to pull their shifts. Their ERs are busier than ever before. We're stressing an already stressed system. And I think what we're finding is that I think people are probably have a little bit of anxiety going to work, a little unknown. One of the things I've found in my conversations with healthcare providers, and you two can speak to this as well, is when you have conversations with people, and even educated, smart people, smart professional people are sitting there going, geez, what don't I know? And there's so much we don't know. that they they end up searching for something. So that's why I wanted to get this information out and try to share this a little bit with the audience and give them a little bit of information, talk to them a little bit about how best we can help, how what we do might be able to help complement what they're doing, and see how we can support them, because we love those guys, right?
Absolutely.
Where do we want to start?
I guess I wanted to start with just a little bit of clarity on what COVID is, because I think there's a lot of misinformation of, is this really a big deal? It's just like the flu. And so I think that seems to me what people are unclear about. So COVID-19 is a coronavirus. It's named 19 because it was first discovered in humans in 2019. The first cases were discovered in China. So the theory is that it started probably in bats, and then it went to some other animal that we're not quite sure which one, and then migrated into humans. So it's a novel virus. When we say novel virus, what that means is that no one on Earth has ever been exposed to it before. And novel viruses, if we're looking at the history of civilization, have meant bad things for humans because they transmit so quickly because we have no immunity to them, right? We've never been exposed to them. It's brand new. So a lot of the fear and this, kind of ramped up response that we have is knowing that there's no immunity, so we have no inborn defense. And because it's novel, we're still learning about it, right? So it's easy to try to compare it to the flu, but really it's nothing like the flu. It's just as similar to the flu as like HIV or hepatitis would be. So we're still really learning what it does in the body and how it reacts. And so again, it being novel and new, we're just kind of trying to keep up with it. So that's the fear is that we don't have any way to stop it. We don't have a vaccine for it. We don't have a medication that works. We don't have a treatment yet. And so getting very serious about quarantine and isolation is really the only way that we have to slow the spread of that until a vaccine is developed or until a treatment is developed. And so that's kind of where this uncertainty comes, where things are changing day by day. It's because we're literally just learning about this virus as we go. We're learning from other people's experiences and hoping to find a new treatment. So I know a lot of ER nurses are like, oh, we've been through this, we've been through SARS, we've been through H1N1, we've been through Ebola, and those weren't a big deal. Those didn't turn out to be anything, but this is definitely different than that just because it's brand new. And so I think it's really important that ER nurses especially are really solid on, what this is, to make sure that we are not putting that misinformation out there, because it's not the flu. It's not just another strain of the flu. It's totally different and new. And so we just really don't know right now what it's going to do. We don't know what it looks like. So yeah, every day we're learning new things, and the CDC is going to be your best source of information to go. That's where all of our guidelines are going to come from, right? They're informed from the CDC. So always look to your CDC website if you have any questions. That's going to have the most up-to-date information. ENA has a really great COVID information page. It's on if you go to ENA.org, and right on the front page of the website is that COVID link, and click on that, and that is going to kind of link you to all of those resources and guidelines so that you can kind of keep yourself up to date there. And then I know Sarah, a little plug to her, on her website, New Thing Nurse, she has compiled another great page of resources for you. So as emergency nurses, it's going to be really important that you stay informed, but know where you're getting your information from. So making sure, and I'm terrible about this, maybe stay off of Facebook or other social media as your main form of information on this. Making sure that you're staying informed, but not over-informed, and just checking your updates on the CDC. If you're an ENA member, ENA is really committed to getting resources when you need it. So, checking your email there, ENA Connect. On our ENA Connect page, the disaster management group, where, if you have questions about what do I do and what are these policies and guidelines, that's a really wonderful community to ask those questions and to get direction. So just plugging some of those great resources for you to stay stay informed. And knowledge is power, right? So for some of us who are type A personalities, just really knowing and understanding what's going on, I think helps in, managing a little bit of that anxiety. So.
Absolutely. And to just piggyback on that a little bit, so now's a very tenuous time because there's so many unknowns. We don't know what information is changing every few hours, every day. There's new research coming out at all these different times. That drives a lot of anxiety, a lot of stress. And if you're in the workplace, at the front line, at the bedside, you may not know how to take care of your patient anymore. Like, you might be a 30-year experienced nurse, 5 years, 10 years, 20 years, whatever that may be. And suddenly your information isn't as relevant as it once was because this is a new entity and we don't know exactly what it is. And I think when the target is moving, it can be really anxiety provoking, can cause a lot of stress and also fear. We're afraid of getting sick. We're afraid of bringing this home to our families. We're afraid of not being able to take care of our patients. We're afraid of our colleagues getting sick. And we don't know where the future leads. And there's more and more restrictions being put on us as private citizens also. So I live in Oakland, California, and currently in the Bay Area, which is Oakland's right across from San Francisco. There are 6 counties here, and we're in a mandated, like a government issue mandated shelter in place policy right now. And I didn't know what that meant when they announced it. I said, what do you mean? Basically, we've all heard of social distancing by now. We need to stay home. We need to try to distance ourselves from others, right? To flatten the curve, which a lot of us have probably heard about. And what that is are all these kind of initiatives to try to make sure that we don't spread the disease, spread the virus. The COVID-19 caused by the coronavirus is spread all over the place. And the Bay Area has been kind of an epicenter for that because we had the Princess cruise ships come through here, and it was before all the implementation of a lot of restrictions and isolation and all these things. So unfortunately, we have it as a community acquired virus now. And so what the shelter in place is, they've announced that for 3 weeks starting yesterday, we're supposed to stay in our homes at all times, except for a few approved errands you can go. So they call them essential errands. So everything's closed except for our grocery stores, our pharmacies, a few other organizations that they have deemed essential, like medical organizations and things like that. However, all elective medical procedures have been canceled. A lot of outpatient clinics have just chosen to close because they don't need to be open. For example, I got an email from my dentist saying that I did not need to come to the dentist office because they were closed for the next couple of weeks. Restaurants are closed, bars are closed. Restaurants are available for takeout only, delivery only options. But that's it. And so you can't go outside unless you're going to those things. Everyone's working remotely unless you're an essential employee, which means like healthcare workers are able to go to the hospital if they're still open in their departments. And you can go outside to exercise, but you're supposed to stay 6 feet away from everybody. And so this is causing a lot of undue stress, a lot of panic, not undue, but a lot of panic and stress in this area. It's another unknown. And that's like just in my private life. So then I'm going to work and there's all these things changing every day. The media is telling me all these different things. And so it's a time to, of course, we're afraid. Of course, we're anxious. I have a long history of depression and anxiety, and every day has been more and more of a struggle. There's been times where I've had several panic attacks last week. I have had episodes where I couldn't get out of bed. My husband had to drag me out. And part of that's because of this pending doom feeling that I have. And I know, and I'm an emergency nurse. So I think it's not that I know something that other people don't know. I think I'm just more aware of how bad it could be. And so that is really stressful to me. And also all these new things going on. And so I think part of it is as nurses, we're very hesitant to acknowledge how we're feeling, acknowledge that stress, acknowledge that sadness, that fear, anxiety. And a lot of us feel alone. And before I was openly talking about my anxiety and depression, I felt very alone and isolated because I didn't want to tell people because I didn't want to appear weak. And there's a lot of stigma around mental health. Everyone has mental health, but a lot of people also have mental illness. And I had that mental illness and I didn't want to admit to it. But over the years I have, and I go to therapy and I'm on an antidepressant. I take panic medications as needed. And the last few days I'm getting contacted by people from all over the country and all over the world through social media through email, through phone calls, through text, and everyone's feeling the same thing, but they're not all open about talking about it with everyone. But like sometimes I think like I'm a safe space because I openly talk about with everybody else.
Well,
And what I say it again.
let me just interrupt you real quick. One of the things that's hard
Sure.
is, as the healthcare professionals that we are, like
Yes.
your families are calling you for advice, your friends are calling
Yeah.
you for advice,
Inundated.
with, hey, what do we do here, and hey, how should we handle this, and should we go to the
Yeah.
ER for this, should we go to the ER for that, and you know, you want to, for the most part, you want to be like, check with your doctor. Like, I'm not the
Absolutely.
expert, you know, unless it's something obvious where you're like, oh my god, you need to go to the ER, or something like, oh my god, you don't need to go to the ER. But that adds to, I think, the stress of healthcare workers, because you know, you're sitting there trying to get your 12-hour shift done, and you're getting text messages from your mom, your grandma, your brother-in-law saying, hey, should we go to the ER? Like, am I going to get this virus? And you're like,
Yes.
you're
And
like,
I
it's
think that
possible, but you think you want to say, yeah, it's possible, it could happen, but hopefully
still
not.
frozen. Hello?
Oh, there you
Hello?
go. You
Can-
froze for a minute.
Okay, there. Yeah, you guys too. That's the last we need. So anyways, to kind of come back, and I ramble a lot, but I think just knowing that we're all in this together, we're all feeling these emotions, whether we want to or not. And the main thing we need to do is boundaries. So that is a great example. Maybe we can't take all the phone calls right now. We can't take all the text messages. We need to make safe space for ourselves at work and at home. We have to be able to decompress, and we have to be able to take time for self-care. So you need to be able to prioritize things like exercise, eating well, drinking enough water, and getting enough rest. And that also goes into the workplace. And those are easy things to forget when you're in a PAPR and you're in this full thing of PPE. You have to remember to drink water. You have to remember to take your breaks, get lunch, go eat, and go pee. For the love of God, go pee. And we have to take care of ourselves so that we can take care of our patients and each other, and especially at this critical time. And so if you're feeling lots of complicated feelings, you're not by yourself. They are valid, but we have to take care of ourselves so we can show up every shift and be the best we can be for each other and our patients.
Sarah, I just want to really just commend you for your bravery, for, being brave enough to, speak about your struggles. And I will say as well, I'm somebody that deals with PTSD and anxiety, and I have definitely felt certainly overwhelmed myself. And I think we know too much, and that informs some of our anxiety. And I just want to take a minute to, like you said, validate our feelings. And part of validating that is that the things that we're scared about are real. A lot of times when we talk about mental health and anxiety, a lot of our fears are unfounded. Sometimes we overthink, and because we have this hypervigilance, we sense danger when it's not really there. However, fear is a protective instinct. And I think part of, at least for me, and this is something I talked about with my therapist actually, is that, how do you manage your anxiety when the things you're scared of are scary things, are real and scary things? And
That's
so
the hard part.
you can't really talk yourself out of this isn't a big deal, because, let's acknowledge these things, because part of, as emergency nurses, how we deal with our fear and our anxiety is we minimize it, which I've seen that reaction of, oh, this is not that big of a deal, this is going to be fine, this is going to blow over, or we deny it of, this is a conspiracy, or whatever. We're seeing all these reactions in our society. But I think as nurses, we need to be brave enough to say, this is scary. We are scared for ourselves, because let's be honest, the newest research is showing that when healthcare workers contract this, they get sicker than the general public. And so we are on the front lines. We're at risk. We're in an environment that is changing day by day. We're in an environment when protective equipment is limited. And so we feel afraid because we don't know if we're going to be fully protected from this virus. We're interacting with a terrified public who, we deal with workplace violence every day. We're used to being at risk for violence, but now we have a public that is maybe panicky and scared and could potentially lash out at us. And there's been a couple of incidences of that already. We have fears of are we going to bring this home to our family? How do we protect them? And, how do we manage our lives when you're on lockdown and your kids are home from school and you have to try to homeschool them and get enough supplies to feed them when you work nights and you can't get to the grocery store? How do you keep your life going and still manage this? So I think it's important that we say it's okay to be scared right now, that the things you're scared are real. And we're all feeling that way. I don't know a single person in general, but I don't know a single nurse who is not scared right now. And it's okay to be scared, but we're all together. And so I feel like this is such a great opportunity for us to talk about mental health and self-care and all of these things that we don't want to talk about as a profession, and just figure them out, figure out how to deal with it and realize, no, it's not weakness to acknowledge how you feel and to face it and deal with it. And when you find that we all feel the same way, then now you have a community that shares your struggles and can support you and back you up. And when we are looking to have good boundaries in our life, like Sarah said, so not just boundaries of, my personal time, boundaries at work, as in like, I've been in this paper for 10 hours. I need to have a break. It's more important than ever right now that we have good boundaries at work, because this is a marathon, right? It's not a sprint. This is not going away. So I think a lot of us think it's going to, that if we get through these couple weeks, your 3 weeks of quarantine or whatever, then everything will go back to normal. And that's just not the case. Part of flattening the curve, as Sarah referred to, which I'm really glad that you brought that up. The reason we talk about that is because it being a novel virus, every person on Earth is probably going to contract this eventually, because realistically, the CDC is not estimating that a vaccine will be ready for another 12 months. So, and then with any vaccine, they're looking at probably 2 years before herd immunity. So that is real, let's be honest and frank. And so what flattening the curve does is slows that down so that hopefully healthier people can have it and get over it and then have that immunity. And that way there's less places for the virus to spread in the community, so that once people get out again, they already have immunity because they've gotten over it. And then if the virus out in the wild doesn't have any, people to attach onto, then it, reduces that spread. And so what we're really hoping for the public to do is give us a breather, right? I saw a really great analogy about the toilet paper, right? Like everybody runs to the store all at once to buy toilet paper, and then the toilet paper is all gone, and then there's no toilet paper for anybody. But if everybody kind of takes their turn, then we kind of spread things out. And so those resources are available for us all to spread. So, at this point, there's no way to contain it. So that's why understanding that, I think, is important to making sure people follow that social isolation and that social distancing, and, really keep yourself at home as much as you can. But at the same time, for nurses, this is not the time to pick up overtime. It would be so tempting right now to look at those open shifts and feel like I have to do this, I'm needed. This is my time, this is what I've trained for. Like, this is our Super Bowl, right? But again, thinking about the long game and that, we are precious resources as well. Like, we are the people that are trained for this. And so we have to protect ourselves as resources and make sure we're not overextending ourselves, that we're taking care of ourselves. They don't know why healthcare workers get more serious cases of this, but I would be surprised if it didn't have something to do with our reduced immunity due to stress, like because of not taking care of ourselves, that stress response. So taking care of yourself, taking care of each other, checking in on each other, giving each other breaks. It's going to be really important right now that we have just a lot of grace and a lot of compassion just for everyone we meet, because everyone is scared. Your patients are scared, the doctors are scared, everyone is scared. And so if there's anything that could bring us together as a species, as a planet, as a community, it's this. Because it doesn't pick sides. It doesn't care who you voted for. It doesn't care where you live. It doesn't care what your religion is
at all.
It does not discriminate. It's the great equalizer. And so I think the more we can use that to really come together, I mean, there's opportunity for lots of, good things to come of it as well. Not just bad things, but hopefully good, growth things for a species and, for our society. And, if we use it as an opportunity, I think there's lots of opportunities here to just really, become better nurses, better people.
Yeah, and we're definitely stronger together, right, than we are apart.
Yes.
I think some key things you mentioned was really like setting boundaries of your time if you're able to. There are areas of the country that unfortunately are doing mandated overtime up to a certain amount. And if you're in that situation, that's okay. You have to do what you can. If you're having to pick up extra shifts because you have a spouse who's out of work, that's okay. You have to do ultimately what you have to do, but there are resources for you. So things that might help you, you can always check in with your employer to see if there's an employee assistance program. Sometimes there's funding available to help you financially. Finances, let's be real, money is a big driver of what we do. And you can only do what you can. So those resources, there's a lot of foundations that are offering crisis funding for different things. So to look in your community at nonprofits and other areas. There are also breaks on fees and a lot of, I know they've moved the deadline for paying the taxes in California by like 60 or 90 days. So there are eviction moratoriums, there are things like rent stabilization, there are things that are being put into place. And so researching that in your area if you're in one of those places. But if you're able to, please just work your regular FTE. This is a very hard and heavy time to be working. And the impact on you is going to be so extensive. And I think often with those things, you don't realize how much they've impacted you until many days later. I think what you are talking about, having grace with each other, is also a really important point, because that's something we can all do for free. Being kind right now to ourselves and to others is a big thing. I see a lot of very angry, frustrated, impaired.
Sorry, I had to change this.
No, we do what we can. We're ER nurses.
Right.
And head injuries too.
I gave an interview once in a closet, so I totally get you. I like, you have to be kind to yourself and kind to others. There's a lot of anger right now, a lot of frustration, totally valid anger, totally valid frustration. But I feel what is most helpful is to have supportive communication. If you feel people are getting very angry, very anxious, maybe rude, impolite, unprofessional commentary to you online or in the workplace or at home or anywhere, recognizing it, addressing it, but doing it in a calm, kind manner, I think will ultimately get you a lot farther, because we are in these moments, that conflict is in this like kind of weird bubble of reality that we're in right now. And we probably will have to see and work with these people 6 months from now. Like, let's be real. So we have to try to be supportive of each other and trying to find out, usually people are really mean and angry and grouchy when there's a reason. Like, they might be scared. That might be how they manifest their anxiety. So sometimes you have to dig a little deeper or walk away and be comfortable with those things. And I always love to plug, I'm very active on social media, and professionalism on social media is a huge thing and very hard to manage sometimes in times of crisis and stress. But know that employers are looking online. You don't want to accidentally break your professional policy, your professional conduct policy, your social media policies, your HIPAA policies, because you're discussing things online in a way that's not compliant with those things. Because the biggest shame now would have people lose their jobs over what's being said online, even in a venting way. All the rules still apply, even if they're not being enforced right now. They can look back, and all that stuff's time stamped, and they can enforce it later. So make sure you're including that kindness of communication, professional communication online also.
I think
these are hard times, but we definitely want to keep our jobs for good reasons.
I think that's really good advice. And one of the things that I tell people all the time is, ER nurses all over the world are sharing memes of, COVID-19 every day, myself included, present company included. But
it's getting me through. Let's be real.
But
I made my first meme actually. So
right.
Right.
But we're all we share this stuff, and there I have the file of stuff I can share, and I have the file of stuff I think is funny, but is not to be shared, but between that and, maintaining the professionalism there, but also maintaining that professionalism of, don't be bad mouthing your employer. Don't be saying, oh my gosh, they don't care about us. They're terrible. All that stuff can come back and haunt you, and you got to be really careful about that. That's going to be the kind of thing that gets people in trouble. I really think. And, I've had the opportunity to do some media, and I'm like really clearly saying I am not speaking for I'm not speaking for my organization. I'm not speaking for my employer. This is just what I'm seeing as a person. So be really careful about that, because that's gonna get some people in trouble.
My motto is always, if your grandma's pastor doesn't approve of it, don't post it, because that ultimately will keep you safe. Like, when in doubt, I'm the first person to put edgy stuff out there at times, but I know my boundaries, and I know the boundaries of my employer and the other organizations I'm in. And I'm always very strict with my media policies. It's hard to live in this world where we have to be so cognizant of what we represent. But this is really a time where, like Kristen and Kevin have said, we are so proud to be nurses. This is a time to be an ambassador for healthcare. And some of the petty commentary that does exist online, like, do you want to be remembered for that or the amazing work that you do?
Well, and, to kind of piggyback off the other things we've been talking about, and I am 100% guilty of this. I will put it out there. And I think it's thinking about the long game and looking at the social isolation and distancing for a lot of us. Like, for me personally, I'll say where I am at, I don't have any family or any other support. And so, a lot of us are going to be feeling really isolated right now, because a lot of the events that we were looking forward to are getting canceled, vacations, travel is going to be really limited. And so a lot of our normal ways of connecting with each other are very limited right now. And so I think for me personally, I know I'm going to have to set a boundary for myself as far as like 1 hour a day on social media, and really kind of making that a haven for just fun and interaction with friends and keeping connected with people, and kind of maybe unfollowing some of the groups I'm in right now, because certainly what I have been dealing with for the past couple of days is feeling kind of like inundated with information, and everything is changing. And if that's all you see in your news feed, I think, especially if you feel if you have a tendency to panic or have anxiety, I think knowing that you have that, it's going to be so important right now to set good boundaries there. And so for me personally, I'm going to be unfollowing maybe some of the nurse groups that I used to be in, just because I know that's going to trigger me and trigger a reaction that's not healthy and could potentially lead me down that path like Sarah was talking about, where you maybe are saying things that you would regret later just because you feel so anxious and like, I have to just do something or say something, or what have you. So setting a boundary there is going to be important, just based on your limitations. So for me personally, I know I'm definitely going to try and keep social media social and keep that as a place where I can keep connected with my family. And then maybe, once a day I'm going to the ENA website to refresh me on what's new, just kind of getting into that routine, hygiene that way, because again, this is a long game. So we really are going to have to figure out how to navigate this new weird world that we're in. Like,
absolutely.
Absolutely.
Now, Sarah, one thing that Kristen just mentioned that maybe you can expound on a little bit. She mentioned checking websites daily. Is the information changing that frequently?
Yes, things are changing not just daily, but also hourly in some cases, especially like in the past 10 days when things were first starting. Like, a lot of the CDC guidelines are changing like every 12 hours sometimes. And that's why at work we're inundated with these changes, like the mask changes, the gown changes, what kind of precautions we're using, isolation precautions are changing. So what I highly recommend is checking in with the CDC and the World Health Organization. So Centers for Disease Control and Prevention and the World Health Organization are the two organizations I would say have the most up-to-date information at any given time. The World Health Organization has a daily media briefing, at least Monday through Friday. That's very helpful. I feel that the CDC, I don't know if they have a media briefing every day, but they do have a weekly email that you can sign up for that's free. And so I highly encourage that. They did a webinar today that was free on Facebook. That's very accessible and informative. And they have a ton of resources on their website, and not all of it, but some of it is changing almost every single day. So the first thing I do when I wake up is I look on those two websites and then kind of play around on social media. The other resources I would say that are kind of incredible are on the Johns Hopkins. They have their own website for COVID, a page that is incorporating a mapping. It's a link to a mapping website that has the most up-to-date, like by the second, of cases, deaths, recoveries, of everything related to COVID-19 globally. And that's an incredible resource because it literally is updated like every minute. And also, I would say that my other favorite couple resources are some of the free online access medical education, FOMED websites. And there's a plethora of them. Anyway, so I try to post, I'm very active on social media. New Thinged Nurse, NEWTHING NURSE, has a very active Instagram and Facebook at New Thinged Nurse. And with those two, really my primary goal right now is just posting very credible sources and anything I feel like that might be helpful for the clinical staff of any specialty. And I personally have made a page on my website, newthingnurse.com, with all my most useful and best resources that I have found as a way. It's open to the public. It's totally available, but also just for me, because stuff is changing every day. If I find a link, where do I put it? How do I organize it? It's very hard. So some of those links I check every day, and those include the ENA website has an incredible resource page, the Emergency Nurses Association, so ENA.org. And then you can click on the COVID-19. It is fantastic and has quick links to almost all of the websites I just mentioned. But you really do, if you're a clinical staff at the front line, it behooves you to look at least at the CDC every day, I would say. And if you have more time and want to fall into more stuff, the World Health Organization, I would say, would be my second go-to. But things are changing daily, and we sometimes know, if you're checking online at those websites, sometimes before your employer. And so that's why knowledge is power, like Kristen said. And so that's a big piece of staying informed. If you only rely on your employer to be informed, they're doing the best they can with what they can, but there's only so much they can do to communicate all those changes constantly given to them. And I have to take my hat off, a moment of salute for every nurse leader that is out there, every director, educator, manager. They have an impossible job right now. Just like frontline staff has an impossible job. We're all in this impossible boat together. And so we have to take a moment to acknowledge the challenges we face and try to empower ourselves with as much of this as possible and be proactive as we can.
Oh my gosh, definitely a shout out to the nurse leaders out there. I talked to a few of them today, and they are working hard. Every nurse leader I know is working well over their allotted hours. They're burning the candles at both ends. And I have to remind them that, hey, a little bit of self-care is okay. You need a day off too. The hospital's not going to fall down if you walk out of it for a day. But it's hard. It's hard as a nurse leader because not only do you feel that responsibility you feel the pressure of having the unit, every patient that's there in the unit and every staff that's there in the unit, you feel the pressure of keeping them safe and keeping them well. And it can be absolutely overwhelming. These nurse leaders that are running units, my hat's off to you, salute to you. Holy cow, you guys are really doing great work and amazing things.
Yes, and it's such a hard situation, but I think including those moments of grace is some of the, some of the staffing policies are really hard to stomach right now. Mandatory overtime is really hard to stomach. As a bedside nurse, it's really easy to get frustrated with your leaders, but knowing that they're facing a huge challenge just like you are, and having those clear, open communication is so essential right now, and trying to be patient with each other and kind to each other will make all of this much easier.
Absolutely.
Yeah, absolutely. My good friend Ryan Oglesby, who is also on the ENA board of directors, he has something he says all the time: assume good intentions, and that is really become a mantra for me in just every situation. To just assume that people are doing the best that they can. And when we're facing things like, our healthcare system is not agile, right? Like it's not designed to adapt to things the way
Not
that
this fast.
things are changing. It's just not, it's not designed to be that agile. And another nurse leader has said to me, do you think administrators want their staff to be unprotected and not have the PPE that they need? No, they don't want that. They don't want to put you in danger. They don't see you as a commodity. Sometimes we feel like a commodity. We feel expendable. We feel like we're not protected in that way. But your nurse leaders truly, I have heard them express so many times that they're really doing the best that they can to give you the resources, within the confines of this crazy hospital bureaucracy that we live in, and then these crazy times on top of it. So, assume good intentions. They're trying their best, and as a frontline staff person, maybe the best thing you can do is just say, hey, thank you to them, because it's not likely that they've heard that in a while. So, just acknowledging that, yes, I see you. We're in this together. We're part of a team, and realizing that they're advocating for you the best that they can. They're out there fighting for you and, trying to get things for you and keep you protected. It's just crazy world. We're all trying to figure it out as we go.
It really is a crazy world. And oh my gosh, I think one of the things you can do, for your leaders is just say that simple thank you. Because boy, I promise, having been in some of those kind of higher level meetings where you're like, you see the nurse leaders fighting for what they're fighting for their staff and doing everything they can. One of the things that we're all feeling around the country is that this is taking an already stressed system and giving that system more stress, and that's hard. That's hard to see. It's hard to do, and it's we're gonna be like the green stick fracture that gets really 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 bent but doesn't break. But it doesn't break. So.
And I think also with that, you can also support your leadership by voicing your needs. Like they may ask you to do unsafe and impossible things, but they're not doing it intentionally. Knowing what the safety guidelines are, being informed, you can help guide them sometimes, and make it a safer place for yourself and others and your patients. And so just having that kind of patient, open communication is key in all things, because you have to advocate for yourself sometimes, and sometimes they don't know what your needs are unless you say them.
And, speaking of advocacy, Sarah, I'm really glad you brought that up, because there's a huge opportunity right now for advocacy. And, as far as your voice being heard, this is the time to be alive there. When the government needs to hear our voices too, right? Like we need to make sure that we're at the table and that we are telling them what we need. And so today, for example, the president met with some nurse leaders from all over the country, and our president-elect Ron Kraus was lucky enough to be one of the nurse leaders invited to participate, which is a huge honor, right?
Ron is at the White House? Oh my gosh.
Yes.
I hope they searched his pockets when he came out.
Yeah, I don't know how they let him in. But no, he got to meet with President Trump today, and bring our concerns as emergency nurses straight to the top. So yeah, completely amazing. So proud of him. Just yesterday, I believe, there was an EN 411. So if you haven't signed up for EN 411 action alerts, this is our advocacy kind of pipeline. This is a really wonderful communication tool that ENA has set up to give people direct contact with their legislators. They craft these great letters as far as a support of what we need, and then all you do is kind of add your name, boom, that goes right to your legislator's office. And yesterday they put this EN 411 action alert out about making PPE a priority, making access to PPE a priority. So there is a national stockpile of PPE. So we're asking that stockpile be opened because there is a need. And then we're also asking that, the supply chain be addressed because, again, this is a long game, right? We're going to need more supplies of PPE. And so with those EN 411 action alerts, we got over 6,000 individual messages sent to legislators, which
Already?
is exponentially more than any other time we've ever used that tool. And so that is a direct message to them saying, this is what we need. So that's what's happening at the national level. Those opportunities are definitely available to you at the state level as well. So if there's, things that you're needing at the state level, make sure you're reaching out to your representatives, your state and local ones, and letting them know what's going on, what you need, so that they can help make those resources available to you. With disasters, with this being declared as disasters, both on the federal level and then the state level, that opens up different funding as well. So, looking into those options and making sure that you're speaking up and saying, hey, this is our need, making sure that you're, getting that available to you there. And also with some of that legislation, there is some paid time off protection or paid leave, paid sick leave, making sure that that is available so that we're not going to work sick in our environment. There is also some childcare, emergency childcare funding in there as well. So that's something that will be available to emergency workers as healthcare workers that will be available to us. So definitely we're trying to make your voices heard, and there's an awful lot of us. So this is a great time to rally and kind of advocate for what we need. So if you're feeling kind of powerless and like, what do I do? What can I do to help? That is a great, that's a great way to put that energy, that stressful energy, to put it towards, action and letting people know what's going on and what we need. So.
Absolutely. Those are great recommendations. And the links to those forms will be available online. So I think Kevin will probably include that in the podcast and YouTube video. And it'll also be on the New Thing Nurse website and also on the ENA.org website. I'm sure it'll be there. I think in addition to that, you bring up a great discussion that we haven't really had, was the shortage of PPE, so the personal protective equipment that we need. So again, those guidelines have been changing, and you need to go to this CDC and the WHO to see World Health Organization is the WHO, to see what is currently recommended and when. We are facing a shortage. There is limitations to what's available, and so working from the top down to try to help alleviate those mask shortages, those gown shortages, glove shortages are going to be key. The government are advocating for stopgap measures to be put in place, but ultimately we need increased production, which takes time. So knowing what you can use, when you can use it, and when it's appropriate, making sure that your employers are also aware what the current guidelines are very, very important. Don't put yourself in danger. The issue of accidental exposure, getting quarantined, we're going to run out of nurses. That is not a renewable resource. We're going to run out of T's, all of us, healthcare workers. So we have to protect ourselves, and the knowledge is power. And so knowing what you need to use, how long you can use it, when you can use it is key. Another thing, a big challenge here in the Bay Area is childcare issues. So our schools are now out to the fall. We are looking at the rest of the semester out, and we don't know when it's going to reconvene in the fall. Every nurse I know is a parent, except for the really new ones. And so that's a huge challenge for them. So getting creative. I know a nursing instructor in South Carolina, and she shared with me that the medical association, like the med school association, residents, I guess, had reached out to her to collaborate with their student nurse association to see if they could provide childcare for some of their residents and nurses and other healthcare professionals in their area. The nursing students, if nurses aren't aware, most of them in a lot of large parts of the country are no longer able to enter hospitals for clinical rotations. And so they're scrambling also to fulfill the requirements for their nursing schools. And that is a whole nother subject we could spend so much time on. Know that you are supported nursing students, and we are thinking of you and are here to help you. but there are some really creative opportunities that we could help support each other. And so I thought this kind of childcare stopgap might be a great opportunity in some areas where they might have availability for that. Also trying to access different resources in our area. There's the mayor of San Francisco is taking all the closed libraries and turning them into study hour kind of opportunities for high school students with certain amount of supervision and infection control prevention protocols in place so that they are not spreading things to each other. You got to do the best you can with what you have. And so it's essential that our nursing staff is supported in that way too, because we're always going to put our family first. And so we need to be able to know that our families are safe and cared for and our kids are watched after to make it to work. And so looking into those opportunities and thinking outside of the box can be key to finding solutions for that in the near future.
Absolutely.
Well, and emergency nurses are great at that. You give us whatever you give us, we'll make it work, right?
Yeah,
we'll
figure it out.
Crisis and opportunity, they always go hand in hand. So again, I see so many great opportunities for creative solutions and to work together. There's going to be so much innovation that comes out of this, and a sense of community. So again, even if you're just at work, if you're having struggles with childcare or getting to the grocery store or whatever, like don't keep that to yourself. Don't act like you have to go it alone, because like Sarah said, every nurse is a mom, most likely. And so you're not going to be a dad or a parent, right?
Don't forget us fellas.
Parent.
Yes, a mom or a dad, a parent. Yes, thank you for that correction. But whatever struggle you're having right now, whatever fear you have, you are not alone. You're not the only person that's having that. And so being able to ask for help. And I know for a lot of us, especially, again, mental health issues kind of goes with that. We feel like maybe asking for help exposes our weakness and exposes ourselves in ways that we, don't feel comfortable doing. But, now is not the time for that. And you just never know. You might reach out to somebody who's having the same type of issues. And, maybe you have you create forces, and on your days off, you watch each other's kids, or, there's just all kinds of creative solutions out there. But I think if you just make your needs known at every level, to your government, to your employers, and to your other coworkers and colleagues, and part of that sense of community is going to be having some debriefings. Maybe we are bad at that, right? But we talk about got to leave it at work, can't bring it home, and here we have this virus that we want to leave at work, we can't bring it home. We have this kind of like physical manifestation of the things we want to protect our family from. And so I think it would be a great practice for units to have a check-in at the end of the shift, and just before you go home, as we're decontaminating ourselves or hosing each other off or whatever we decide we're going to do for this. Hey, how are you doing? How are you handling this? Are things okay? Is there anything you need? Do you need to cry? You know what? I've cried. We've all cried. Like, it's okay. And part of not bringing it home is we don't want to scare our kids, right? We don't want to scare our family. We don't want them to be anxious. So, giving yourself permission to experience that with your colleagues and say, you know what, this is hard. I'm really struggling today. And I think just having that connection with people and a safe place for us, like you said, Sarah, building safe places where we can let that anxiety go and release it so that we don't hold on to it and bury it. We can release it, which heals it, leave it, process it. Mm-hmm. And then when we get home, then we are clean from all the bugs and the viruses. We're clean from all of these yucky emotions. And then that allows us to be present with our families, because yes, it's a struggle, but at the same time, it's a gift because we're all stuck at home, right? The kids are at home. We're all in the same place. We can't go anywhere. Really take that time to be present when you're there and enjoy that time and make the most of it, because I think now more than ever, we just know that there's no guarantees in life. You just never know what's going to happen. And I think to really be present, this is such a great opportunity to really be present in your life and in your home and in your world, and really refocus your priorities and create those good boundaries between work and home, right? Work and self, create those really good boundaries.
And I think the importance of community, we also have to get creative in how we're hanging out with our community. Like I live in California, my family lives in Southeast, in Georgia, North Carolina, Kentucky. I have friends all over the country as an advent of a lot of my involvement with the Emergency Nurses Association. So how can we get creative and check in? So I was just talking to my mother-in-law about this today. She's really bummed that her book club cannot meet. And I was like, well, why can't you do a Zoom book club? Using like FaceTime, Skype, all these video platforms, and getting your group together. I know of ladies who are having their own happy hour virtually. I know moms who are having like mom hangouts and homeschool events with the kids. Doing online exercising, virtual yoga, like all these things are opportunities to get creative and connect with our online community and our physical community online. And so we're going to have to do more check-ins. We're going to have to be more comfortable with more texts, more calls, and more videos. But we're so lucky to live in this time of technology that can allow us to be so present in each other's lives, even though we're many
far away.
Yeah.
You know, one of the things that was very comforting for me is you messaged me from Norway, and he's like, hey, you know what? We're having a hard time here too. We're going through all the same struggles you guys are going, maybe a little bit worse. And you know, just that sense of community. And one of the things that, you know, you talked about the sense of community within your unit, and I think that being able to decompress with people who are there, they're there elbow to elbow with you, and they know exactly what you're going through, and they know exactly what it's like to take care of those patients that you're taking care of. So it's important to lean on those guys, and you're going to get closer to your team than you ever have before, because we're all fighting the same battle, and we all have a unified front. But not only that, just in your unit, I got to tell you, everyone knows I'm a big fan of ENA, and the fact that, you know, you have your virtual community. You have your community all over the world, and people from all over the world from ENA and just emergency nursing in general. And what an incredible network that is to get involved with. And, you know, here we are, the three of us are all three in very different places, and yet we can get together here and have some community here and be able to share some information with the audience. So I can't stress enough how this just makes me feel good. So hopefully it makes you guys feel good too. And hopefully you guys feel like you're part of this community and you're here having this conversation with us. Hopefully you feel like you're part of this too. So.
Absolutely. And I can't tell you, Kevin, how excited I am that this podcast is happening. You have been such a support to so many. I have followers who find you, I think, through my stuff and through New Thing Nurse, and they just will message me sometimes and be like, oh my God, Kevin's podcast helped me so much because of what he talked about with so-and-so. And so I think also accessing those things, so podcasts, Audible, like book recordings, online groups, websites, all these things are great opportunities to really get in touch with your medical community. And the medical community is coming together right now because we have to share that information to help care for our patients, because things are changing every day. So I can't express enough how important it is to, if you're online and like social media, to check in with the different medical groups that are on there. And if you ever want to reach out, I'm very active, Kevin's very active, Kristen's very active, and we would always be happy to listen to you if you ever need a moment to vent in a safe space. That's, I think, what all three of us have and really been passionate about, is creating supportive, safe spaces for nurses everywhere, nursing students, future nurses, aspiring nurses, retired nurses, whatever they are. And so I think that the internet is a great place to find that if you can't find that in your own physical space at your work.
Absolutely.
And Kevin, I'm really happy that you've done this by video, because I know for me personally, with some of that isolation, that like YouTube videos are hugely helpful, because even the podcast is great, but even there's just something about like seeing that person's face and hearing their voice that makes you feel a little bit less alone and definitely more connected. And so there's tons of great YouTube videos with information or about whatever, if you're looking for, hey, I'm stuck in my house, let's have a new hobby, or I want to learn something or whatever. But yeah, the more we can be face to face with each other, I think is going to really help us maintain this sense of community, even though we can't see each other physically as much as we would like to anymore. And I think keeping that in mind for some of our patients. So like, I see a great opportunity if you have an elderly patient that you're taking care of, maybe taking the opportunity to say, hey, can I call somebody for you? Can I use FaceTime on my phone? And, is there a family member that you want to call and just talk to and see? Just keeping in mind that our patients are just as isolated as we are. And, with these isolation orders and social distancing and things like that, we're creating distancing with all of the hazmat gear that we're wearing as well. So making sure that we are connecting with our patients in a human way is going to be beneficial. It's going to be harder. So we're going to have to be really careful that we're not treating our patients like a thing. And it's so easy to do that. And we have to be mindful, because remembering that our patients are human and scared, and we're going to need to connect with them, and that's going to help us as well. I feel like being able to connect in a human way with your patient is so beneficial to me personally. I have found in my practice, if I can find those ways, and I think it's going to be easy in a lot of ways here, because it's going to be easy to acknowledge, hey, I know this is scary. I know you're scared. I'm here with you. That will be helpful to every patient you encounter. I know you're scared. I'm here with you. And just making sure that even if it's through gloves and through your gown and whatever, that you're, touching a hand, that you're within proper, CDC guidelines, that you're taking those opportunities so that our patients don't feel isolated and alone either. Because let's be honest, between the two of us, it may be the only person who touches them or talks to them physically for that day for a long time. For a lot of us, maybe who live alone or are distance from family, like you and me, Sarah, it may be the only human contact we get. So through the long game, just making sure that we are not forgetting about those soft skills, because I feel like right now they will matter more than ever to just the wellness of all of us as humans to get through this.
Absolutely. I think one of the things I challenge all the nurses that listen to this podcast and watch this video, one of the things I challenge you guys to do is really double down on the kindness. Like, be twice as kind as you normally are. And I know you're normally kind already, otherwise you wouldn't get much interest out of this podcast. I hope. But in reality, double down on the kindness. Your patients are incredibly stressed. They are terrified. As you, as an educated professional, are way more up to date on what's going on than they are probably, and you're terrified, so they're terrified too. So double down on the kindness. Understand that when people are under stress, they don't always behave the way they want them to behave, and you get to be the stack the deck for you by being the calm in the storm, and being the kindness that they get when they actually show up at our hospitals.
Absolutely.
One of the things I'd like to kind of finish up with, and it's something that I've shared on the internet, and I want to just kind of share on the podcast in case you haven't seen it. But it's this ED shift decon routine, basically how to kind of get yourself home. As many people know, my wife's immunocompromised, so if I'm working a shift, if I'm going to be in the ER throughout the day, then there we are. If I'm going to be in the ER a lot during the day, then one of the things that I really do is I make it a point to really come home and kind of decontaminate while I'm there if I can. I have a second set of scrubs at home that or at work, that if I need to change scrubs, I have that. I'll encourage you to get a second pair of scrubs, even if they're hospital scrubs, even if they're the old ratty ones that don't really fit great. Bring a second set of scrubs with you, have them in the car, and change before you leave work. So change out of your clothes before you leave work. That's going to get one layer off. Wash yourself up. I used to work with a guy named Ryan who used to say, I'm going to scrub out, and he'd scrub from his hands to his elbows every day before he left work. Not a bad practice right now with COVID-19. Wash yourself, wash your hands more than you need to. Sanitize like it's your religion, and take off those scrubs and really clean yourself well. Then when you're in your clean scrubs, you're driving home. As soon as you get home, my work shoes don't make it into the house. My work shoes live in my garage. They're taken off there. Don't bring those dirty shoes. That sometimes you bring shoe covers, sometimes you don't. Don't bring those dirty shoes into the house. Take your shoes off. I always Lysol mine. I have a little can of Lysol right there. I'll just give them a quick Lysol spray them down. Take off the shoes. I get undressed in the garage, I take my clothes right to the washer, and I go straight to the shower. Then after the shower, hot soap and water, cleaning myself well. Then at that point, I can come out and I can kiss the wife, play with the dogs, do all that kind of thing. But I really kind of recommend having that kind of decon process if you're involved in taking care of patients every day. You know, for someone like me who's not taking care of patients every day, I probably don't need to do that every day. But boy, if I'm spending a lot of time in the emergency department or if I'm taking care of patients, I was recently at the Houston Rodeo and I came home and I deconned myself before I ever walked in the house, just because I was in with all these people. But sure enough, man, clean, do that, decompress, and it gives you a chance to decompress as well too. So it's going to make you not only your body cleaner, it's going to make your soul cleaner too.
Yes. Yes.
Absolutely. Yeah. I was so thankful to you, Kevin, for putting that resource together. I think there's something about routine and ritual that really is really good for peace of mind. And so I feel like just having that out there so people know what to do, and that way they can feel that their family is safe. They feel like they're not bringing that stuff home. It just gives you kind of a sense of security, right? If I do this every time, I'm going to be clean, and now I can go home and be with my family. Yeah, it's a wind down routine that we don't normally have, probably, which is a lot of the issues that I think that we have as nurses with mental health, which is a whole other topic. But yeah, that was just another great opportunity for you to build in good self-care, like good. I take care of myself, I take care of my family, because in this, it's more important than ever. You got to put your action on first, right? We are front lines. We're going to be taking care of all these sick people. And so if we are going to run this marathon, ourselves have to be our priority. So your family always has to be your number one priority in this. And know that for all of us, that's where we're all at. So if your kid gets sick and you have to go home, do it. There should never be a second thought in your mind right now of taking care of your life and the things that are important to you, and doing what you need to do. I know as nurses, a lot of times we feel guilty, attending to our own personal needs, and like, this is not the time for the martyr, this is not the time for martyrdom. This is not the time for victimhood. This is not the time for that. Like, it is time for us to prioritize ourselves, because the only way that our country survives truly is if there are competent, healthy nurses available to take care of them. So put your own oxygen on is my put your action on yourself first, because if we're not taking care of ourselves, there's no hope for anybody else.
I think that's great. And I think I've got very similar views, but I've been keeping it to 3 things. It's stay home. So if you don't need to be out and about, don't do it. I know a lot of young people who'd feel great are out traveling and taking advantage of the cheap airfare, and people love to travel. And I don't blame you for being tempted, but the research does show that asymptomatic people, if they have the virus, can be shedding a ton of virus all over the place. So you can be super contagious and not feel bad at all. And you may not even have symptoms during the course of your illness, which is the really scary part. So think of your grandma, think of your grandpa, think of the kids, think of people around you. Stay home, hang out online, and don't go be tempted but to travel all over the place, especially these extended spring breaks for you students. So stay home's a big one. Stay clean. I think Kevin covered that beautifully. Hand hygiene is our number one priority, and stay safe at work when you're staying clean, and then just stay kind. That's my main 3. You got to be kind to yourself, be kind to others. And I think if we do all of those things, and follow the research, the data, advocate for ourselves, advocate for our patients, we're going to get through this.
Absolutely.
Yeah, absolutely. We got this. Like I said, we
got this. I like that.
ER nurses, we got this. This is what we train for, right? We remember the Ebola, the donning and doffing and decon. I mean, we got this. This is our Super Bowl. This is what we've been training for. So we just got to hang in there and take care of each other, and we'll get through this. We'll get through it.
Ladies,
well, thank you.
I can't thank you guys enough for taking the time to do this podcast with me. I'm going to get this one out quicker than I usually do. Get this out just as quick as I can, because again, this information may change. So check the CDC
We
website.
expired in an hour, Kevin. Work hard.
Right. So, but I thank you guys for doing this with me. I really, really, really appreciate it.
Thank you. And I just want you to know, like, again, we're all online. So if you need someone to talk to, please reach out. So my website is www.newthingnurse.com. I'm on Facebook at New Thing Nurse, Instagram at New Thing Nurse, NEWTHINGNURSE. Anytime, reach out. And I know Kevin has an open door policy and Kristen also. So we're here to support you and to communicate with you. So if you need a safe space, we are here to create those safe spaces.
Yeah, my direct line for those of you, kristen.cline@ena.org. If you go to the ENA website and under governance, my contact information is there. Email me. I think my phone number maybe even is on there. Text me, whatever. I am here for you. We all are here for you. So feel free to reach out if you need anything. And then ENA, obviously your professional organization is here for you. ENA.org has the most updated information on COVID that has its own COVID page. We have the ENA Connect communities, EN411. All of those resources are there for you as an emergency nurse. So now more than ever, get to know those resources, avail yourself of those resources there. I tell you, we had our board meeting in Chicago last week, and it was amazing to see how the staff adapted to our changing environments. We went from poor Joop talking about Joop in the Netherlands. He was here on Wednesday, and then Wednesday night got the notification that he had to go back because of the travel restrictions. And so Thursday morning, he was up on Zoom for our board meeting, sitting there connecting, and a couple of our other board members were unable to travel because of issues at home, or one of them was sick, and we all connected through Zoom. And then on Friday, when it became clear that we would need to work from home, all of the office staff were home up on Zoom, and we were kind of doing business as usual. So it's just been really inspiring to see the organization kind of rally around, what do we need right now to get through this, but at the same time, how do we keep going and keep moving forward, and making sure that the business of what emergency nurses need all the time doesn't get lost in this, haze of, what's happening right now. So again, I've never been prouder to be an emergency nurse than I am right now. So I love you guys all.
Yes. And I think the best thing you can do is tune into the Art of Emergency Nursing podcast. That is the best way.
Thanks for the plug. Thanks for the plug. It's a good time to sit and binge listen to podcasts.
How many do you have now, Kevin? You have hours and hours of content.
Gosh, I think like in the 70s for episodes.
Social isolation entertainment. So
absolutely get
listening.
Binge listen today, and follow us on
Facebook.
Follow us
Some
on
Art
Instagram.
of Emergency Nursing and Chill. Is that
That's
what
right. That's right.
I bet that could be a thing.
That could be a thing.
We're gonna make it a thing.
So, anyways, ladies, I can't thank you enough. Thank you so much, and we're gonna have to get on and do this again about something else, I'm sure. So
absolutely, it was so much fun. Thank you so much for inviting us, Kevin. It was a lot of fun.
Yeah, this was, and we can't wait to come back.
Yep. Thanks, guys.
All right.
Thank you.